I want to be really clear about something from the start. When someone comes to me and says, "Doctor, I'm always tired," there's usually a reason. It's not just something you have to accept or live with. Our bodies are incredibly good at telling us when something's wrong, and persistent fatigue is usually a sign that something needs attention. It might be something simple, or it might be something more complex, but there's almost always an answer. Let me start with the most common culprit I see in my practice, and this might surprise you. It's actually sleep deprivation. I know that sounds obvious, but here's the thing. It's not just about the number of hours you're sleeping. A lot of people think if they sleep 6 hours, that's fine. They think they're getting enough sleep. But your body actually needs somewhere between 7 to 9 hours of quality sleep every single night. And I'm talking about actual restorative sleep. Not the kind where you're waking up at 2 a.m. to check your phone, or you're tossing and turning all night. The reason your body needs this much sleep is because during sleep, especially during deep sleep, your brain is literally cleaning itself. There's a system called the glymphatic system that activates when you're asleep, and it removes metabolic waste products that accumulate during the day. Think of it like taking out the garbage. If you don't take out the garbage regularly, it piles up and everything gets messy. Same thing happens in your brain. If you're not getting enough deep sleep, those waste products build up, and that makes you feel exhausted. Beyond that, when you're sleep deprived, your body produces less of a hormone called orexin, which is what keeps you alert during the day. At the same time, your body produces more cortisol, which is your stress hormone. So you've got a double hit, less of what you need to feel awake and more of what makes you feel stressed. No wonder you're tired. Now, the other part of sleep that people don't talk about enough is sleep quality. You could be in bed for 9 hours, but if your sleep is constantly interrupted, you're not getting the real, deep sleep your body needs. Common reasons for this? Stress is huge. If you're lying awake at night thinking about work, finances, relationships, your nervous system is activated. Your mind is running at 100 miles an hour. Sleep apnea is another one, and this is really important because a lot of people don't even realize they have it. If you're a heavy snorer, or if someone's told you that you stop breathing during sleep, that's a red flag. Every time your breathing stops, it wakes you up. Sometimes just for a few seconds, but it fragments your sleep so you never reach that deep restorative stage. That's why someone with sleep apnea can sleep for 8 hours and still feel absolutely exhausted. The other massive factor in sleep quality is your sleep environment and your habits. Are you looking at your phone right before bed? Because the blue light from your screen suppresses melatonin, which is the hormone that tells your body it's time to sleep. Are you drinking caffeine late in the afternoon? Caffeine has a half-life of about 5 to 6 hours, which means if you have a coffee at 3 p.m., half of that caffeine is still in your system at 8 or 9 p.m. Are you exercising right before bed? That gets your heart racing and your cortisol up. Are you sleeping in a room that's too warm? Your body actually needs to be cooler to fall into deep sleep. These seem like small things, but they add up. All right, so let's assume you're actually getting 8 or 9 hours of quality sleep and you're still exhausted. What else could it be? Well, let me tell you about one that I see constantly. Thyroid issues. Your thyroid is this little gland in your neck, and it controls your metabolism. When your thyroid isn't working properly, everything slows down. Your energy production at the cellular level drops, and you just feel like you're moving through life in slow motion. Hypothyroidism, which is when your thyroid is underactive, is incredibly common, especially in women. And here's the frustrating part. A lot of people are told their thyroid is normal when it's actually not. Why? Because a standard blood test might only check TSH, which is thyroid-stimulating hormone, and sometimes your TSH can look normal on paper while you're actually having thyroid problems. That's why if you're experiencing fatigue along with other symptoms like dry skin, weight gain, brain fog, hair loss, or feeling cold all the time, you really need to ask your doctor to do a more complete thyroid panel. That should include TSH, free T3, free T4, and thyroid antibodies. If your doctor pushes back and says they don't need to do all that, maybe it's time to find a doctor who will listen. Now, another really common cause of fatigue that people often overlook is iron deficiency. Iron is essential for your blood to carry oxygen throughout your body. If you don't have enough iron, your red blood cells can't do their job properly, and your tissues don't get enough oxygen. This makes you feel weak, exhausted, and sometimes even dizzy. Women are particularly susceptible to this because of menstruation. If you have heavy periods, you're losing blood every month, and that iron needs to be replaced. But here's what I see a lot. Women will be told, your iron is a little low, take some supplements, and then they're never checked again. Iron supplementation needs to be monitored. You need to know if it's actually working. You need follow-up blood tests. Speaking of blood tests, let me talk about another condition that causes significant fatigue: anemia in general. There are different types of anemia, not just iron deficiency. You could have B12 deficiency, which is really common and often overlooked. B12 is essential for creating healthy red blood cells and for nerve function. If your B12 is low, you'll feel exhausted, you might have brain fog, you might have tingling in your extremities. Folate deficiency can cause anemia too. Some people can't absorb B12 properly due to a condition called pernicious anemia, or they might have celiac disease or other absorption issues that prevent them from getting enough nutrients. This brings me to nutrition in general. I can't tell you how many people come in exhausted and they're basically running on coffee and whatever's convenient. Your body needs fuel to create energy. If you're not eating enough, or if you're not eating the right things, your body doesn't have the building blocks it needs to make ATP, which is the energy molecule your cells use. Let me break this down. First, you need carbohydrates. I know carbs get a bad rap, but your brain and muscles use glucose for energy. The key is eating the right kind of carbs: whole grains, legumes, vegetables, not refined carbs and sugar, because those cause blood sugar spikes and crashes that make you feel more tired. You need protein because amino acids are needed for everything from neurotransmitter production to cell repair. You need healthy fats because your brain is mostly made of fat, and these fats are essential for brain function and hormone production. And you need micronutrients, vitamins and minerals, because these are cofactors for the enzymes that produce energy at the cellular level. One more thing on the nutrition front. Are you drinking enough water? Dehydration affects cognition and energy levels. A lot of people think they're tired when they're actually dehydrated. And honestly, we're kind of in a state of chronic mild dehydration as a society because we're drinking a lot of coffee and sugary drinks that actually dehydrate us more. Okay, so you're sleeping well, your thyroid is fine, your iron is fine, you're eating well and hydrating. What else? Let's talk about mental health and stress. Your nervous system has two main modes: sympathetic, which is your fight or flight response, and parasympathetic, which is your rest and digest mode. When you're chronically stressed, your sympathetic nervous system is constantly activated. You're in a low-grade state of alert all the time. That takes an enormous amount of energy. Over time, your adrenal glands, which produce stress hormones, can become exhausted. You might develop something called adrenal fatigue or HPA axis dysfunction. Now, the condition itself is debated in conventional medicine, but what's not debatable is that chronic stress absolutely causes fatigue. When you're stressed, your body is constantly producing cortisol. That's good in the short term. Cortisol helps you handle stressful situations. But chronically elevated cortisol does a lot of damage. It suppresses your immune system, it increases inflammation, it interferes with sleep, and it drains your energy reserves. Beyond that, depression and anxiety are huge causes of fatigue. Depression doesn't always look like sadness. Sometimes it just looks like not having energy to do anything. Anxiety keeps your nervous system ramped up, which is exhausting. Let me talk about another one that's becoming increasingly common: Autoimmune conditions. There are over 80 different autoimmune diseases, and you know what symptom they almost all share? Fatigue. When your immune system is attacking your own body, that's an inflammatory process, and inflammation is exhausting. Your body is literally fighting itself all the time. Common autoimmune conditions that cause fatigue include lupus, rheumatoid arthritis, Hashimoto's thyroiditis, celiac disease, and others. If you have fatigue along with other symptoms like joint pain, persistent infections, rashes, or gastrointestinal issues, you should ask your doctor to check for autoimmune conditions. Now, I want to talk about something that a lot of people don't connect to fatigue: movement or lack thereof. If you're sedentary most of the day, you might think that would make you less tired, but it's actually the opposite. Exercise is one of the most powerful tools we have for increasing energy. When you exercise, you're improving oxygen delivery throughout your body. You're increasing mitochondrial function. Those are the powerhouses of your cells that produce energy. And you're improving sleep quality. People often say, "But doctor, I'm too tired to exercise." And I understand that, but sometimes you have to push through that initial resistance. Light movement, even a 20-minute walk, can actually increase your energy. I know that sounds counterintuitive, but it works. Let me also mention hormonal issues beyond thyroid. Women, this especially applies to you. If your estrogen and progesterone are out of balance, particularly around perimenopause and menopause, fatigue is a really common symptom. Men, if your testosterone is low, that can cause fatigue as well, along with loss of muscle mass and decreased motivation. If you're on birth control or hormone replacement therapy, that can also affect your energy levels. Another thing I see a lot in my practice is medication side effects. There are so many medications that list fatigue as a potential side effect: antidepressants, blood pressure medications, antihistamines, you name it. If you started a new medication around the same time your fatigue started, that could be the connection. Don't stop taking your medication without talking to your doctor, but definitely mention it to them. Sometimes there are alternatives with fewer side effects. Let me talk about another cause that's actually becoming more common: chronic infections. This could be something like Lyme disease if you're in an area with ticks, or mononucleosis that's resolved but left you with persistent fatigue. It could be chronic viral infections. It could be parasitic infections, especially if you've traveled. It could be chronic urinary tract infections, which are more common than people think, especially in women, and they can make you feel exhausted and unwell without obvious symptoms. If you have unexplained fatigue, sometimes we need to actually look for infections that might be hiding. Here's another one: blood sugar dysregulation and metabolic issues. This includes prediabetes and insulin resistance. When your blood sugar is constantly going up and down, your body has to work overtime to regulate it. You get energy crashes and you feel exhausted. If you find yourself needing a snack every 2 hours, or you get really irritable and tired in the afternoon, this might be your issue. I also want to mention environmental toxins and nutritional deficiencies beyond what I've already discussed. Things like magnesium deficiency are really common, and magnesium is essential for energy production. Vitamin D deficiency is incredibly prevalent, especially if you live somewhere with limited sunlight, and low vitamin D is associated with fatigue and depression. Chronic exposure to things like mold, air pollution, or other environmental toxins can cause inflammation and fatigue. Now, here's what I want you to do if you're experiencing chronic fatigue. First, keep a fatigue diary for a couple of weeks. When are you most tired? What did you do the day before when you were more tired? What did you eat? How did you sleep? Sometimes patterns emerge from this that are really helpful. Second, look at your sleep objectively. Are you actually getting 7 to 9 hours? Is it good quality sleep? Make the changes I mentioned. No screens before bed, cool dark room, consistent sleep schedule. Third, Schedule a doctor's appointment. Your doctor should run some basic blood work. At minimum, that should include a complete blood count to check for anemia, a metabolic panel to check kidney and liver function, thyroid testing, iron studies, and a vitamin D level. If those are all normal and you're still exhausted, you might need to dig deeper. Fourth, look at your stress and mental health. Are you stressed? Are you getting enough rest during the day? Do you need to talk to a therapist or counselor? These things matter. Fifth, examine your nutrition. Are you actually eating enough? Are you eating a balanced diet? Do you need to see a nutritionist? Sixth, think about movement. Can you add a 20-30-minute walk to your day? Can you start some gentle yoga or stretching? Movement is medicine. And here's something I tell all my patients. Fatigue is a message from your body. It's trying to tell you something. Sometimes that message is, you need more sleep. Sometimes it's, you're stressed and you need to relax. Sometimes it's, something is medically wrong and you need to get it checked out. But there is always something behind it. There is always a reason. And once you find that reason and address it, you're going to feel so much better. I know fatigue is frustrating and it's exhausting, pun intended, but I want you to know that you don't have to just accept it as part of life. It's not normal to feel constantly exhausted. There is help. There are answers. You deserve to feel energized and healthy again. Thanks for watching. If this video was helpful, please like and subscribe for more healthcare information. And if you have questions about fatigue or what might be causing yours, leave a comment below. Take care of yourself.